And Sarah's going to moderate this conversation.
I am.
Okay, let's find out what it's about.
So why don't you two start by introducing yourselves and the work that you're doing right now?
Okay, so my name is Ronnie Walker. I am actually from Amity. I'm from the facility. I got here in '06. I slept in the room across the street on 3rd floor in Sedan. Back then, Amity was a 6-month program for all parolees. I stayed for 2 years. They had put me out. I wouldn't leave. This was the first place that I actually, I've been in prison in 3 different states. So New York, Boston, and here. I was tired of going to jail. I became to the point where I was afraid to leave. I was afraid to leave because I kept repeating the same behavior over and over. So I stayed as long as I possibly could. And I ended up staying and working for Amity. And I still never left. So basically, I was a demonstrator across the street for years, and now it's to the point where I just work on Main Street, at Amity on Main Street, with people that's chronically homeless and have mental health issues. I joined the Los Angeles Poverty Department theater group that just was here, which is open to anyone if they're interested in acting and putting on performances. And you also do, they travel and stuff like that. But meanwhile, it's just meaningful. So the name of this theater group is Los Angeles Poverty Department. And it's a jug at the Los Angeles Police, basically. You know what I'm saying? So we're named LAPD too, And we put on performances that are thought-provoking and truth, Oh yeah, and I joined in '07, something like that,
You got to go back to New York, I believe. Well, I think we should find out who from the staff has joined the conversation.
Sure. Do you want to introduce yourself?
I'm filling in for Dr. Abraham, so I'm not sure what I have to say, but we're the medical care for you guys. We're at 42nd and Avalon, and we are here with you guys at Amity. So what we provide is medical for you guys. If you guys don't have insurance within those 30 days that you guys are released, we try our best to get you in medical with an IPA. So if you need to be referred to any specialist, you guys get to see that specialist. After you guys are done with this program, you are more than welcome to continue care here or go to 42nd and Avalon. And we have more providers. I think it's 9 of them that do care for every patient. We see different entities, so it's not just Amity. So we see Beacon, Health Right, and other places, transitional housing and regular patients. So there's they have a lot of they have a food drive if you guys need help with that. They have housing if you have LA care. So we provide a lot of help for everybody that's coming and transitioning out to the society. We have case management, we have mental health. We also provide, well, right here, if you guys need that help, we'll refer you out there, or you guys could be seen here. If we could provide it and bring it to you, we'll make it accessible for us to bring it here. I don't know what else to say because I was over.
What's your name?
My name is Sandra, and I've been with CEDREN for 4 years. Amity, I'm going on 2 years. So, yeah.
Thank you, Sandra, for coming in. John, do you want to introduce yourself?
Yeah, so, okay, I'm John, and I started doing theater workshops in Skid Row like 40 years ago. And so I thought it was like the harebrained idea that wouldn't die, And because I thought it might have a trajectory of 1 minute, but actually people people wanted to do something, and people wanted to be together, and they wanted to be able to share their ideas and their thoughts in an atmosphere where they could share, just do that, you know, and not have any sort of constraints on that. So we, you know, so surprisingly we've done a lot of stuff. We've been all over as Ronnie said, we've been around the country and out of the country, but our focus is really on working in Skid Row. And this performance, as I said before, it was about the innovations of providing health care to people who were houseless or didn't have a place to quarantine, and how the things that were discovered, the practices that were discovered there, were so exciting that they're going forward. And a lot of that is happening in Skid Row. It's sort of a conjunction of insights of medical providers on how to be welcoming to people and really hang with them and get people to address unaddressed medical needs and maybe find housing and stuff. And also they've built on or used the practices that have showed up in Skid Row over the last many years of listening to the community. And that's the big thing. There have been a couple of initiatives in Skid Row. Tom and our group has been really involved in them. One was the Refresh Spot, a 24-hour place you could use the bathrooms, wash your clothes, take a shower. And for several decades, there was a back and forth where there's no, there are no toilets available for people living outside. And then after 10 years, they put a porta potty up. And then the police or someone would complain to the police that people are doing drugs there, they're doing prostitution. We started calling it, the porno potty. And then they'd be taken away, right? And then it'd be another 5 years, they'd come back. So finally, there was a community effort, and there was someone working with, Lisa Orduña was working with Mayor Garcetti at the time, who had the novel idea of, why not listen to the people in the community? And the people in the community, she met with them for many years, and they came up with an idea of a 24-hour place where people could use the bathroom and do their clothes, and in a friendly atmosphere, staffed by people from Skid Row, so that there wasn't a lot of aggressive security guards or anything that people understood when we were doing. So as a result, it's been hugely successful with thousands of people using it each month. And so the Skid Row Care Campus that Tom mentioned in the performance that's about to open builds on that, as well as these medical practices of bringing all the specialties together, really listening to the patient, having low to no barrier of entry. You can just show up, And so a lot of the people, some of the stories from the story about the blind man who's got his cataracts healed when he was at the quarantine respite site. Like he had been discouraged from getting medical care everywhere else. It was like he'd had bad experiences, so he ended up just going blind. So by having a welcoming place, again, staffed by, there are a lot of community members that are right now they're hiring people from the community because it's about to open this care center. And it's going to be a place where you can just walk in, you can get a bed, you can detox if that's something you need, you can see a physician, you can see a mental health person, you can also just hang out. It's a beautiful campus with outdoor space, and we're going to be doing workshops that are going to be a lot of other activities going on. So it's just a really welcoming place, and there'll even be people where you can get a permanent bed there. So the performance sort of looks at what the medical people have discovered, and also the sort of how to deal with the community that's been discovered and implemented in these few cases in Skid Row. And so in the show we said we had a bunch of community conversations with all the doctors and nurses that you heard quoted in the performance, and with the community members, and their thing was like, these kind of places should be created in every neighborhood of LA County, or at least every SPA, which is a service provider area of LA County. So we learned what those letters meant, and we found out there are 8 of them, as someone said, the 4,000 square miles of LA County. So our goal is to do at least one performance of this play in each of the 8 spas. So far we've secured ones in 7. We're still looking for one like in Whittier, somewhere Whittier, Norwalk, which is Spa 7 Southeast. So anybody who has a clue on a community venue or people you know out there that would want to have us do it out there, we're going to follow up on it. But otherwise, yeah, we're going to every spa. This is the second time we've been in this spa, which is Spa 6. And but we're going to hit each spa at least one time. So that's our crazy mission.
Yeah, thank you everyone for introducing yourselves. So I'm going to ask just a couple questions and then open it up to the room so that you all can ask questions. All right, we got some soundtrack for that. So we heard a little bit about access and the different things that can be accessed through the program that you're part of, Sandra, and also the ways that access become really important or maybe become a barrier if there isn't enough access to some of the programs that that we're talking about in the performance, for example. One thing that I've noticed in all of your responses is there's sort of this component of time to all of this. Like John, you were just talking about how the refresh spot took years to actually develop, right? And there was this long point in time where there was a porta potty for a while, and then there wasn't for a while. And we see that in the performance too, with the waiting and the waiting and the waiting for housing. So I think I'm just, my question is around how are you all creating access in what you do right now or in what you're advocating for? And also, is there a way or a message that you kind of see is there a way that we can actually communicate that this is an emergency, that this is something that needs to happen now to create this amount of access versus, you know, at some point off in the future?
Okay, I can answer some of that. Okay, so Amity has really changed since I was here in '06. Now Amity has took and been very, very aggressive, not only with opening up campuses, but with also getting contracts in order so that when you end up completing while you're here at Amity, when you complete this process, that you're not going from here to the streets, you know? So, so what they did is Amity got the stop contract. So now the stop contract actually allows you not to leave here and go from here directly to home when you leave here. In other words, it's like, okay, so I haven't been home in a long time, and if I just leave here without not having too much, I might become a burden actually on my family. I'm taking stuff out of their mouth. So therefore, you can leave from here. If you're not on the stop contract here, you can leave here, you can go to Beacon, and then still continue on the stop program. And then you should be able to get like 6 months and then an extension. Also, now that's why you're still working, okay? Also, Amity has these different grants that they get. So right now they have one that's gonna be starting next month. Whereas, say if you have a certain income, your wife has an income, whereas you guys can live together, long as you can afford to pay. So Amity basically has a program where they'll pay your rent for the first 6 months to let you keep stacking your money when you leave. and you keep stacking your money so that, but then you take on the rent after that. You know, and Roz runs that program. And then, so it had changed some, but that original grant is coming back again. Yeah, Jennifer, yeah, I think in May it starts back again. Or it just started, but it'll be up and running again in May. So, those things basically didn't actually exist when I was here then, but there's a lot of things that they have now that will help you. Because I'm gonna tell you honestly, I got addicted to saving money when I was here. Because they was taking to 70%. I had to save 70% when I was here. So of course I told you, I'm starting working on a job making $8 an hour. Time I was working here, and it got to the point where I had 10 grand, they wouldn't take my money no more. You know, and I stayed here for 2 years working off a minimum wage. I think I did get to $8.50, but because I was getting income tax returns too. You know, so man, by that time, like it was actually time for me to go. But anytime they try to ask me to leave, I tell them, you know, this demonstrator used to take pictures of us when we came in. So I was tore up when I came in. You know, so I used to pull the picture out and tell them, you don't want me to look like this again. You know, that was my thing. You know? Yeah, you know, you don't want me to look like this again, you know? So I use that to my advantage, you know, and that's because every 6 months they was coming at me, you know. So, but however, man, Amity has a lot. Please don't leave here to go sleep on somebody's couch. Please don't do it. It's not necessary. Don't leave here to go sleep on somebody's couch. Don't leave here and, which I have seen some of my other people do, is they leave here and they're working, they're making money, they're saving money, and they move in to an apartment and their name is not on the lease. They move in with somebody. And then they tend to plush things out. You know, oh no, that little 32-inch TV, no, we getting a 70-inch. We getting this, we getting that. And after you plush it all out, things go wrong. Then, and the weather is usually always bad. Then it's time for you to leave. Now, when the police come, of course, we don't want to have no contact with the police anyway. And when they get to talk about, you know, you leaving, and you're taking from here only what you can carry, you got to leave everything else. You might can take them to small claims court and try to get the police to escort you back and get your stuff after 6 months. And who knows if stand is still there. But however, man, when you can leave from here, you can get your own spot. Then if you want to move somebody in, then you can do that. But I would say stay here just long enough to stack whatever you can stack, then go to the after program, stack whatever you can stack, and then try to get your rent paid for 6 months. That's my suggestion. That's what I impress upon everybody, you know, because when I actually left my money here because I was scared. So, you know, I was scared. Crack was still outside. And even when I went to the bank and took the check to the bank, I said, look, man, if you start seeing some strange things like drawings coming out of my account, it's not fraud. It's that I'm smoking. Close my account down. Yeah. I told them straight that, you know. But I ended up with these characters, you know, and they helped pull me through, push me right, kept me on the right track, you know. I haven't been handcuffed or back to jail for 18 years.
Well, for us, when you guys get released, we tend to see you guys immediately to get you going I know Steve and Mario start off your medical process. We keep an eye out if there's anything that prevents it. I know some of them get approved and then they get a rejection because it still shows incarcerated. So we kind of guide you guys through. We don't just leave it to see what happens. We keep an eye out. We do have enrollment that comes here Monday and Tuesday to help you guys get a primary care if it change. Usually insurances change you and chooses your provider without your notification. So we have somebody that will stay with you on the phone and guide you through to get to where you want. So which is here, because it's convenient for you guys to walk here. You don't need to put a ducket no more. You know, you have us here Monday through Thursday. Well, Tuesday is podiatry. And then we did start with Dr. Abraham, which he's not here today, but he is also doing medication for some of you guys. He could do it over the phone. That's another thing. Once you become, you have Medi-Cal, you're not CDCR no more, you guys can have phone appointments. You don't have to come here if you're working and going to school, so that's not gonna prevent you from getting your medications, or if you have questions or if you're sick, we're able to help you guys out. Again, we try to get you guys on Medi-Cal within 30 days of release from CDCR, which is your corrective care insurance that they provide for you guys.
Hey guys, please, while you're here, right? This is, okay, so basically, you're really not laying stagnant. You're not. You're here. You're from where, I don't know, that the last time when I was in jail, they had already started charging $5 for medical visits. Okay, but anyway, in this case, it's not gonna cost you anything. And furthermore, it's right across the street. Take advantage of it. Take advantage of the time that you know, because remember, Amity is a process, you know, like it's different lodges. Once you get, like after 4 months or something, you're able to go out, job search, whatever. However the system is now here. Take advantage of getting all your medical stuff together while you're here. Before you start going out there, like she said, you could call from work and get your medication or whatever. Find out, you know, listen, if I was to slow down, I found out I had diabetes once I got clean. You know, it wouldn't have been that way if I was still out messing around the streets and messing around, because I thought a hit could fix every issue, every problem that I ever had. Toothache, headache, backache, whatever, you know. All I needed was a hit and I could get back home. So, you know, so please take advantage, right, of this medical stuff. Find out what issues that you have, you know, and as a whole, right, a lot of guys come out, you guys, well, me too, I was real healthy when I came out, but of course I tore that up myself, you know, but you're generally in pretty good shape, you know, but find out if you got blood pressure, you know, whatever it may be, man. Just address it while you're here, early, you know? And while you're not actually, you're going to classes, you're working on yourself, you're building character for yourself and stuff like that. Because then once you start going out, and it's like, you get the job, and this and that, you know, and then you're going through your little probation period, whatever, man. That's for those of you that plan on leaving. Some of you probably going to end up staying or going to work for Amity or somewhere, or whatever. But just work on that medical now while you got the time to establish it.
Good advice. John, do you want to add anything? Or I think that one of the things that I'm hearing from both of you is that the advantage of a place like this is that it is a place where you can go and where you can find all of these services. So maybe if you want to say a little bit about why this project thinks that is so important in other neighborhoods and other places.
Yeah, I mean, well, obviously, Amity is an extraordinary program and a good example of the, you know, what's needed generally. You know, the performance is just about people on the, you know, on the street who wouldn't necessarily be able to access this program, but the sort of principles in the, I mean, look, this is a beautiful place, right? It's always nice just to be at Amity, because it's a beautiful place, and it has all this, all this spiritual symbolism around it everywhere from diverse, it's very welcoming for all possible beliefs and stuff, and it's just a beautiful spot. So the idea is that other such beautiful spots should exist and be available to anybody, no matter what their situation is.
Yeah.
Maybe we should check out.
Oh, okay, yeah. Why don't there are questions?
Okay. Oh yeah, I'd like to thank Paul for handling the technical aspects of this evening. Paul, where you at? I really thank him, man, his crew, cameraman. I really just want to thank all you guys for just taking out this time, right? I hope you liked the performance. We had actually did some other performances here, like the state of incarceration, when which we're probably gonna have to bring that back at the rate things are going, because they're talking about privatizing prisons all over again and this and that, and we had bunk beds, those are the 3-tier bunk, no, 2, we had the 2-tier bunk beds, and
next time we'll have the 3-tier.
So it was state of incarceration. We did that play. I went on to New York with it, and we did that play a lot of places. We did it here. I don't know if we did it more than twice. I think we may have did it twice here. I think. I'm not sure. Yeah.
Well, inside baseball, we did it here before we got the beds. So we just had mats on the floor. It was a maiden voyage.
Our maiden voyage. Yeah. So and then we had people that played. The cast was much larger than the one we have. It was male and females in it, and some were police, some were, mass majority was the inmates, and of course I was an inmate in that. I was true to form, a lot of us. And we just addressed the situation of how California just dealt with mass incarceration. That was it. It was just lock everybody up. They're gonna privatize it. They made money off of us, and that's all. So we just bring things to the forefront, man, about what's going on, what they're doing, and and other things that try to be done to us that's basically inhumane, really. Yeah.
So I heard that someone had a question, but it was over my shoulder somewhere.
For the medical.
Yeah.
My question is, what is the process? Because right now, KEDREN is the primary care. What is the process after leaving here, going somewhere that KEDREN is nowhere near? What is the process? What do you do?
So a month or two before you go home, you might want to check in with the enrollment and see if they can help you. Again, if you were to leave, in your back of your medical card, they have a phone number you could call and do a primary PCP change is what they call. But you would have to have a location and a doctor that you already know that you want to go to.
So it's best to find a primary care physician.
If you have a choice, it would be good because that way we know and we can help you with that. But it would take like about a month because remember, keep in mind, we don't know what their status is. Like here, it's easy for you to get an appointment as a new patient versus another clinic. It might take you a couple of weeks or a month or so because they're saturated. So maybe that's, in their case, that might be the problem. So you just want to be ahead. That way you don't get stuck with not having one or the other, especially if you need medication for any medical illnesses that you have, you don't want to stay without the medicine. Or you could also get a 90-day refill and then give you those 3 months to kind of get where you have to go.
Thank you.
Anybody else?
Anyone else want to ask a question?
Yeah,
Who's in the back?
In regards to these grants, who do we contact for, the administrator or who?
Who did they contact for the grants?
Oh, you talking about for the grant when leaving
Yeah,
here?
yeah.
Well, Roz is in charge of that. So I'm here all the time.
Okay.
I'm here all the time. So just talk to me. I think you have to be like, depending on, I think the last time cause I work with her every day. So I think it was like, you get at it like when you, like within 4 months of leaving. What's your name?
Marco.
Marco. Okay, all right, I'm Ronnie. Okay, yeah, and Christian, you can always, Christian is over. Christian, you can contact Christian, and Christian can contact me, or Steve, or whatever, at any time. At any time, man. I'm available all the time. I haven't did a vacation, I don't know how long.
Thank you.
You know, yeah. Yes,
Thank you.
yeah, no problem.
Anyone else?
I have a question.
Mm-hmm.
When you were sharing, you said that you was in a program, but first before you was in a program, you was on the streets doing cocaine?
Yeah.
And
After I got out of prison, like a lot of us, we get out of prison, and the bus, we go to the bus, right? The bus stop was at one time it was on 6th in Los Angeles, then it was on the 7th across Alameda, and a lot of us, we wouldn't make it from the bus stop. We just end up in Skid Row smoking. We get, you know.
so you're saying you never made it home?
No.
So what changed? Can you talk about what made you change your life? What was the point where you wanted to come back to your senses? So can you talk a little bit about that?
Yeah, so.
To get in the program and do work and do what you're doing today.
Okay, so what happened was, I was a type that I felt that I was born in New York. I came here when I was young here, right? And so like I started going to prison maybe like when I started catching real hard cases, like, cause all those places that I went, I actually went to prison. I didn't go, it wasn't just the jail, like, no. So I really started going to prison like at 24. So I always felt that it was nothing wrong with me and what I was doing. It was something wrong with the state. That's why I went in so many places, because every place that I went, I took me with me. You know what I'm saying? So I started off being, this how it happened. I started off being the man with the Cadillacs, all that kind of stuff, tailor-made clothes and all that, to the person behind the dumpster standing on my tippy toes because it's human feces all around me trying to take a hit. That's how I ended, right? And so, you know, it was that gander, that respect, you know. It went from total respect to me trying to hide from elementary kids going to school in the morning, because that's when I was told who I really was. They torment you. They're very honest. You know, look at that crackhead. Look at that smoked out. You understand? So that's how the end. That's how the end happened. And I always felt that the state was the problem for me. So I get busted, New York. Then I run to Boston, because they laid off half their police force while I got into cases in New York. and then I get busted there, and I bail out, you know what I'm saying? Then I run back down here, so then I got all these cases, and I'm being extradited, so they extradite me back to all these places that I done messed up at. That's how I got to that point. When I got to the point where I was out here, after I finished all them up, and I got out, finally came down here, and then went to prison here. Then I said, well, boom, I was really tired. I was honestly tired. And then with the kids humiliate me, you know what I'm saying, like in the daytime and stuff like that. So what happened was, my parole officer told me like he was gonna bring me here. But he asked me, listen, if I give you some bus token, can you get there on your own? And I told him, no. He said, that was a good answer. You know what I'm saying? That was a good answer. So he handcuffed me and brought me here in handcuffs. And that's how I got here. And when I got here, but I didn't know anybody here. It was just total strangers. And when I first got here, I was really in bad shape. They let me sleep for a couple of days. Then when I got up, after I had did my interview and all that stuff, and I got up, and because then it was a team of people that were here is the ones that interviewed you, you know, so, you know, I told them what my goals was, and I wrote promise notes and stuff like that of what I wanted to try to accomplish here and stuff like that. And when I got here, they humbled me and told me about after I got up on the third day, they told me that I was going to be on trash detail. They don't know me, I don't know them, but however, by them telling me I'm on trash detail, and they had no idea who I thought I was. You know what I'm saying? You know, like, how dare you? Like, I'm trash. I'm doing. Anyway, I did it. So I didn't want to go back outside. So I did it. So, and it humbled me. And then I just worked for now. I just kept every demonstrator. I picked their head and I messed with them and I talked with them. And you know, they got to talk about. I heard other people whisper, "Yo, man, they got favoritism around here. They got favoritism." I'm just telling them, listen, if you want favoritism, then become a favorite. You understand? That's what you do. You know, if not, then well, stop crying. And I just kept on, and I've never looked back. But however, I didn't get here till I was a week before my 51st birthday. And my head, I had so many cases, my head turned gray when I was like 23. So dudes, younger dudes, and a little younger than me, like 18, 19, I was only 24 years old, they was calling me Pops.
They called you Pretty Ronnie.
Yeah, when they called me Pretty Ronnie, yeah, later. And I did get that name on the street, though. But yeah, you know, so yeah, that's basically a lot about my life. You know how it turned out. But this place, I owe them everything. I never left, and they humbled me, taught me how to get back to real life. So, you know, I'm in my kids' life and everything, you know, things turned out very good.
So it sounds like it's hope. Just keep hope in your heart.
Yeah.
Oh, thank you. Thank
Yeah,
you.
because I thought it was over for me. I was old when I got here. I was old. I thought it was over. I thought I was washed up. And they also had like, if you had a felony back then, you was hard to employ, you know? Yeah. So actually when I got here now, me and the guys that got here back then, we made it better for the people here now. Because when I got here, you couldn't even be hired by Amity unless you were off parole for 3 years. Off parole for 3 years. Now you can be on parole and Amity can hire you. Yeah. So,
That's great.
you know.
Thank you so much for
Yeah.
sharing.
You're welcome.
Great story.
Thank Right?
So I got a couple of questions for the whole ensemble, right? Going back to what the cause was for the play. Just a representation of, you know, the society that we live in. Because I remember when the things on Skid Row was like at its lowest, at its worst. I just went down to a job fair like last week.
Oh, yeah.
That's where I saw it at. And so, and I saw some of you guys. So just looking at how things are getting better, you know, for the population down there. I wanted to know, did all you guys come off of Skid Row before this? And my next question is, what are you guys doing now? Well, she shared her story. Yeah. Right? So for the rest of the ensemble, what are you guys doing now?
But it took work like he said. I didn't just get
No,
off
I know.
the street. I had to go to school.
Before we answer those questions, can we thank Sandra for being part of this?
If you haven't been seen, we're here. Like I said, there's new patient packets on the door. You guys are more than welcome to grab one and then come the next day except for Tuesdays and Fridays. And we'll help you coordinate the date that is best for you to be seen. Just get checked out.
You're going to be Monday through Friday?
We're not here on Tuesdays and Fridays.
Thank you.
So we're here
Monday, Wednesday, and Thursday.
from 8 till 5.
Thank you.
So just come and check in if you have any questions after you guys leave. But do you guys have any questions? Because I gotta kind of step up. All right, thank you.
Thank you. Thank you.
I
Yeah, go
felt it
ahead.
was very important what he was saying, since
It was.
we're in a program. When you think, he said my story, but it was like his. I worked very hard when I got off the street. When you're in the program, they want you to go to school, get a job or something. I went to USC and became a volunteer social worker. And I was helping the people that I slept on the streets with. And I just wanted to say, they said, if you can do it, I can do it. So it's very important. It's a process that you have to go through to build yourself up, like this young man was talking about, when you're out on the streets and you're trying to get your life together. And he said that the way he was talking, it was like, if you don't have together, one person can say one thing to you, you're an alley rat. You're back in the alley because you didn't have confidence in yourself. But once you get into a program, do what they tell you to do. You're not running nothing. AA tell you that. I'm in AA, so I know. But this, if you really want to make this program, take one step at a time, one day at a time, and believe in yourself. That's what I was hearing from this young man, you know, and it's so important. You know, we're here to do a play, and it's beautiful because we want to acknowledge the frontline workers that did care about working with the people on Skid Row. When Kaiser, Good Samaritan, Cedar-Sinai wouldn't have looked that way. A lot of people lived, and I'm going to tell you a story. A lot of people on Skid Row today living in them kids have more dignity about themselves because they was taken care of during the pandemic when he said, oh, if I go on that floor, I might die. Because they needed a pizza or whatever. Doctors went out and got pizza. If they needed drugs, they went out and got doctors, social workers, to keep them people alive. So you have a lot of people with more dignity that don't have nothing. That's less than fortunate. But when you're cared for and you have tender, loving care, you got better people out there today because of the pandemic. Believe me. So if they can do it, you guys can do it. You have a program that want to help you and give you health care. Go for it and get it.
Thank you.
You're welcome. Now, I really wanted to know what these guys are doing now, right?
My finances collapsed. I ended up living inside Union Rescue Mission, if you're aware of that, for about 3.5 years. And so I was right in the center of Skid Row, and you can walk to City Hall. So I began walking to lots and lots of meetings to try to figure out why are things so screwed up. and how can they get better? And so I found out about LAPD. So we do plays, but we don't, hopefully they're entertaining, but we don't do them to be entertaining. We do them to raise different issues to help educate people, to help empower people, to do advocacy on how to move forward. So for me it was perfect because I love the creativity and the theater, but it was just natural for me to like, well, this is another. So you can go to City Hall and do public comment, when they're talking about an issue that's important to you, and that's one way of doing it. Or you can be in a play, and you can, in a sense, your public comment is now a dialogue that you're memorizing. But for me, it's all the same thing.
That's right. I'm Amity. I'm from the Netherlands. And
Surprise!
That was an act.
And I didn't know nothing about Skid Row. We don't have a Skid Row in the Netherlands. And I met John when he was there doing teaching at a theater school. Or an art school. And I fell in love with John. And that's how I came to Skid Row. And I never left. I've been on Skid Row for 26 years. Yeah. But I never lived in the street. But I've been in Skid Row for 26. So yeah, that's my home, really.
There's just a lot of hidden treasures now. People just look at the problem and not.
Yeah. Exactly. Wow. That's what you need.
Hello.
Hey.
I have lived in Skid Row. I have worked in Skid Row. I came to Skid Row in 1990, but I know about Skid Row as a child. Went to Grand Central Market when I was a little girl, my mother, great-great-grandmother. And now they have all these restaurants. But I've seen a lot of things change from Skid Row. I was a speaker in every hotel of doing recovery down on Skid Row. From the tea house, I worked at the wine garden with the homeless shelter back in the 90s. And I'm still coming back after, now y'all count from 90 to where I'm at right now, then you know how long I've been coming back. I've been with this gentleman ever since 1996. I'm an OG.
All right.
I love God. I met Ariane later, and I'm still coming back. I don't live down there anymore, but I used to cook down there for people that was in St. Julian Port. I used to cook for SRO. I did it all down there. And as me come back and I see what I see now, it's amazing because when I was down there, it was Skid Row boxes.
Yeah.
Not no tits up in the sky looking like it's New York City, okay? But I know I've been sober ever since 1990. I went to Jane Clayton Center, which was in Hollywood. Jane Clayton is the white lady that used to be the original of Lassie program that were black and white film. I was in her program. My sponsor was Mr. Wilson. He is the founder of Volunteers of America. And he was my sponsor in his program. I almost got thrown out because I brought a relationship, but it changed. The relationship decided to leave, and I stayed. I got my 6 months, I got my certificate. I got my 6 months outside of the program on the east side. Never been there. Carver program. I never been on the east side of my life. I was scared as hell. But I got my 6 months, went to court, got my kids back, and I'm still here. So I know there's a higher power, there's a God, whoever y'all believe in. They used to say, I believe in a donut. You go right ahead. If that can save you, believe in that. But I know who God is to me. I am a gospel singer, if anybody heard me singing. I've been singing ever since I was 7. My father was a minister. My mother was a missionary. I'm still giving back. Even though I've been sick, I've lost a big toe from diabetes and neuropathy, but God brought me back last year again.
Amen.
So I'm here for a reason, not just a season. All of y'all is in here for a reason, not a season. Believe in yourself, you will achieve, and you will succeed. She said she passed.
Sorry, sir.
No, the play was outstanding. It brought me to tears. I was actually, kind of like dropping tears behind my back. I understand the problem, and the isms down there, and how people just overlook. I got people, I got uncles and aunts that was down there. I understand.
Let's give him a hand.